When it comes to healthcare for our youth with complex or unique health needs, it's important that you and your youth have all the information you need to make good health decisions. Transition planning is important because having a plan reduces anxiety about upcoming changes. Parents and youth need to be prepared for new roles and expectations. It may take time to find new doctors. My son and I want to share some tips we have about healthcare transition. That is, the period of time when a youth moves from a pediatric to a more adult setting. This is an exciting time, but it definitely takes some planning. Here are 5 questions to ask your youth's doctor that might make this transition go more smoothly. First, around the time your youth gets to be 16 or 17, ask your provider, at what age must we leave your practice and move to an adult-focused clinic? Second, ask, will you refer us to a new provider? Third, if you don't make a referral to a new provider, will you make a recommendation for finding one? Fourth, how will you help our youth get ready to start seeing a new doctor? And last, will you work with the new doctor so they can get to know our youth? Now here's a short example of a parent and youth talking to their pediatrician about how the transfer of care will work for them. As you watch the clip, remember that your doctor will give different answers depending on their clinic's policies, but the important thing is to ask the question to get the information you need.
Hi, Sam. It's good to see you for your checkup. How are you?
Hello, Dr. Brooker. I'm good. Can't believe I'm halfway through high school.
That reminds me, looking ahead, how long can Sam stay in your practice? When do kids need to move to an adult care provider?
That's one of the best questions you can ask. At our clinic, it's when he turns 21 or moves away to college. I know elsewhere it can be as young as 18.
So we have time?
Yes and no. Choosing a new doctor is a big decision, especially for someone like Sam, whose care is a bit more complex. You don't want to be rushed. I recommend you start the process early, maybe a year ahead of time.
When we do start looking for a new doctor, do you make the referral or do we start searching on our own? Where do we start?
Either way, I refer or you can research on your own. You'll want to check your insurance, see who's in your network, and confirm they're taking new patients.
What if we can't find someone right away? Can you still write his prescriptions until we do find one? What if there's an emergency?
Don't worry, I'll be your doctor until you get established with another practice. We'll continue to provide anything necessary until the transition to your new doctor is complete.
Oh, I have a question. You've been my doctor for a long time. Switching to a new one feels like a big deal. Will you help me get ready for when it happens?
Absolutely. We'll set aside some time to talk about how things will be different. You'll have a few new responsibilities in the adult setting. You're smart to think about it ahead of time and prepare.
Will you also help my doctor get to know me?
When I make a referral, I'll give them your full medical summary and make sure they have a clear picture of your situation and what you need so you get the very best care.
One last question. As you know, Sam sees 3 specialists. Should we be having the same conversation with them?
Yes, talk to those specialists now. Learn about their process too. It's so much easier when you plan early. Let me make a note in the chart so we talk more about that next.
That's great, thank you. I feel better having a plan. We know some families who've been caught by surprise, and we don't want that to happen to us. To recap, ask these questions when talking to your youth's doctor. At what age must my child leave your practice and move to an adult clinic? Will you make a referral to a provider who serves adults? If you don't make a referral to a new provider, will you make a recommendation for finding one? How will you help our youth get ready to start seeing a new doctor? Will you work with the new doctor so they get to know our youth? The Oregon Family to Family Health Information Center has a tip sheet to get you organized. To receive the tip sheet or for other support, contact us at www.oregonfamilytofamily.org. This video was developed by parents, students, and health professionals working together. Thank you.